Well, this was just a session on GI cancers, and there were 3 speakers. 2 of the speakers talked about pathways that are being targeted by different drugs to treat patients with different kinds of GI cancer. Cancer in the pancreas, cancer in the colon, but they also have effects in other tumors. And they spoke a lot about why different chemicals are not working. And it turns out that as the drugs are studied in greater detail, that some of the pathways are very complicated and that the agents don't necessarily block the pathways fully. What I talked about was a little bit different. I'm a liver doctor, and I talked about liver cancer, and I talked about how the liver changes the kinds of cells that it has when it gets injured. And what it's trying to do is repair, and it's mounting a wound healing response. And what we've learned is that during that wound healing response, that some of the same pathways that come on that are present in the developing human, and that they play a big role in modifying the environment of the liver so that it will repair itself. But the unintended negatives of that whole process can be the outgrowth of cells that are progenitor type cells that give rise to cancer. And so when we start to develop therapies for liver cancer, maybe targeting these pathways would be helpful, and they've not been targeted in the past.